Alright, so today I'm here to talk to you about multi-planar movement. It's a quick little video, shouldn't be too long. We're going to talk about three main planes of movement. So we're going to talk about the sagittal plane dividing the body left and right, the frontal plane dividing the body front and back, and then the transverse plane separating top and bottom. And we're also going to look at five separate joints: the glenohumeral joint or the shoulder joint, the scapula or the shoulder girdle, as well as the lumbar, and then the hips and the knees. So starting with the glenohumeral joint or the shoulder joint, there are several movement points. This is one of the most advanced joints that you have in your body other than your wrist. So we'll start with flexion, extension, and hyperextension. So when you bring the arm forward along the sagittal plane, that's flexion, extension back to the side, and hyperextension back. I'll show you from the side view. Flexion, extension, hyperextension. One more time. Flexion, extension, hyperextension. Now, along the frontal plane, we also have two movements. We have abduction and adduction, abduction and adduction, and abduction and adduction. Now, you can also do horizontal abduction and adduction. That's horizontal abduction, bringing the arms out, and adduction back in. Horizontal abduction out, horizontal abduction back in. Now you move your arms laterally out and medial back to the midline, back in. That's adduction. Now we also have rotations. So there is outward rotation here along the transverse axis, inward rotation, outward rotation, inward rotation, and outward rotation. Once more, inward rotation. Now, the shoulder girdle, it can do several things. It is a very immobile joint though. So the first thing is elevation and depression. Elevation, bringing it up, depression, bringing it back down, elevation up once more, and depression back down. As well, there is abduction and adduction. So bring your arms forward, abduction, bring your arms back, adduction, abduction, adduction, abduction, adduction. Now there's also upward rotation where you bring the scapula up and then back down. So upward rotation is this, up, downward rotation, down, upward rotation up, downward rotation down, upward rotation up, downward rotation down. Now moving on to the lumbar. The lumbar can move in, again, three ways. So there's flexion, forward, extension, back to midline, and then hyperextension, past the midline. So flexion, extension, hyperextension, flexion, extension, hyperextension. Then we also have side-to-side flexion. So flexion, and again to the other side, flexion, and to the other side. And once more, flexion, and to the other side. Now, you can also have transverse rotation, which looks a little something like this. Rotation, 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 and once more, rotation, rotation. The hips, again, a lot of movement in the hips. Now you have from the side, flexion, extension back down, and then hyperextension. Once more, flexion, extension, hyperextension. And one more time, flexion, extension, hyperextension. And then moving along to the frontal plane axis, or you can make movement in the way of abduction, adduction, abduction, adduction, abduction, adduction. And finally there is rotation, so hip up, you would rotate internal rotation, external rotation, internal rotation, external rotation, internal rotation, external rotation. And finally the knee joint, you have flexion, extension, flexion, extension, flexion, and extension, and internal and external rotation. So internal rotation, external rotation, internal rotation, external rotation, and internal rotation, external rotation. Thank you.